Welcome to Adapting Class. Pharmacology can feel like the hardest part of your NCLEX preparation or in NC school subject that you have to overcome. In this video, I have 10 questions on pharmacology, step by step. We're going to break down with rationale, connect each drug to its biggest concept. You'll walk away feeling really confident with your pharmacology exams and your preparation. Stick around and let's get to it. First question, it looked intimidating. I got you. Don't worry. Take your pen and paper and look at the way I'm going to approach it. How do you answer? Question, read it from the back. Which of the following medication should the nurse question before administration? Medication safety. This is one of the biggest areas students have issues with. Medication safety. Select or apply. You got to question something. And nurse is reviewing medication prescription for several clients. That means nurse has ordered to give a prescription to each patient, and there are 6 medications over there. Which one of these information, medication, should the nurse have a pause? Basically, question and say, no, I should do something before administering each medication. How do you answer this question? Look at the medication and look at the parameters given. Digoxin, right? 1.125. What is the pause? Apical pause 56. Should you give it to the patient? 2 milligram of haloperidol IM, 25 milligram diphenhydramine PRN. Why do I combine the two together? There's a concept there. Furosemide, 40 milligram PO. Patient potassium is what? 4.2. Is that okay to give to the patient? Heparin infusion, that means it's a drip, 1,000 units every hour. And the patient is also receiving what? 5 milligrams of what? PO coumadin daily. And the INR is what? 1.2. This is content. I intentionally make this a little bit difficult, but we're going to use common sense and critical thinking. Metformin, 500, BID, PO. Patient blood glucose is what? 120 to 150. It's okay to give it to the patient. Furosemide, 40 milligram PO. The patient also is taking spironolactone, 20 milligram PO daily. Why? Patient has what? Ascites and potassium of 4.9. Look at the situation. Know the side effect of the medication and ask yourself if it's okay to give to the patient. The digoxin, the dose, if your pickle pulse is less than 60, you should hold it. Therefore, that's a problem. 2 milligram haloperidol IM. If I give it to you, if this is an antipsychotic, you worry about what? Neuroleptic malignant syndrome or extrapyramidal side effect. Therefore, I will give you 25 milligrams standby in case you develop those symptoms, especially if it's extrapyramidal side effect. Therefore, this is acceptable. Furosemide, 40 milligrams. Potassium is 4.2. It's not that bad. It's okay. Heparin infusion drip in addition to coumadin, but look at the INR, 1.2. That means the patient INR is not therapeutic. You can bridge heparin and coumadin together. That's the concept I want you to take with this question. Metformin, 500 milligram BID. That's the usual dose. The glucose is that. It's fine. Furosemide, 40 milligram. And then you get in what? Spironolactone, 20 milligram. Both of them are what? Diuretic, but they do different things. Think about it. Furosemide will lower your potassium. Spironolactone will keep your potassium together. Patient has what? Ascites. What are we doing? Potassium is 4.9. If I give you furosemide, it goes down. If I give you spironolactone, it comes up. Therefore, we're going to stabilize it. It's going to balance it. This patient is okay. What do you think is the right answer? Put that in your comment and let me know. Let me know what you think about this answer. As you can see, there's only one answer choice in the question. All the other choices are appropriate. This is the test-taking strategy I want you to use with pharmacology. This is the way you should approach the pharmacology. So memorize the information, pay attention to the key concept, and use it to answer the question. Each of the questions I've given you has its own key concept. Number 1 is done. Number 2, don't run away. This is a next generation question. in the form of pharmacology. You can see these questions in the case study form, nursing school on NCLEX prep. But this is something you should be comfortable with. When you see it, don't run away. This is all medication administration. It's a key portion of pharmacology. And nurse is assessing a client before what? Administering medication. Which of the following data should the nurse obtain? Select or apply. That means, which of these do you think the nurse need to obtain before they can give the medication? If you're in nursing school, during your clinicals, and you're about to administer medication, which of this you're going to ask for the patient, or you check? If you are taking the NCLEX and you see this question, which one do you think is appropriate? Do you check for herbal product? Do you check for daily fluid intake? Do you check for ability for the patient to swallow? Do you check for previous history? Do you check for allergies? Do you check for current vitals? Do you check for family history? What do you think? If you're going to give a patient medication, of course, I need to know if there's a herbal product they're taking that can interfere with the absorption of the medication or make the medication worse, especially with comedy. Daily fluid intake, what do you think? This is not relevant to the medication you're giving. Whether they're drinking a lot of water or not, it's not going to affect the absorption of the medication. But if they have issues swallowing, that's the biggest problem you should know. Previous surgery should not affect the medication administration to a patient. Allergy, of course, it does. They are vitals, especially if they give them something that can drop their blood pressure or their heart rate. I need to know about it. Your family history has nothing to do with medication. There's some certain situation, but for your NCLEX, make it clean. Family history, if I'm going to give a patient some medication, I don't care about their family history. Therefore, this is the way you should approach it. It's a straightforward question. It looks intimidating, but I know you got it because you watch Adapting class. Therefore, allergies, vitals, medication history, swallowing ability are the key things you need to know before you can administer the medication to a patient. What is your score? 2 out of 2. I hope so. Number 3, read the question the way I approach it. Put your comments down in the question. Let me know how you're doing. Which of the following medication order should the nurse implement first? Same thing. This is prioritization, patient prioritization. You have 4 medication and there are scenarios associated with it. Which one will you give it to the patient first? And nurse is reviewing medication prescription for a client. Patient has 4 medications. Which of these would you give to the patient? It's the same strategy like question 1, but it's a little bit slightly. But I want you to use some common sense and critical thinking. Don't run away from it. The Digoxin, same dose, 0.125 milligram PO. Patient epical pulse is what? 57. Furosemide, 40 milligram PO. Potassium, 3.1. Morphine, 2 milligram IV. Respiratory rate is 12. Insulin Lespro, 5 units sub-Q. Blood glucose is 200. Which of this would you give to the patient? The question look a little bit intimidating, but all is asking you to think critically. Which one would you give to the patient first? There's a strategy there, and there's a trap. Some of the answers may not work well because the patient condition should not allow you to give the medication to them. Look at number 1, the Digoxin, epical pulse is less than 60. You should hold it. Therefore, even though it's a very good medication to give, in this situation, we have to hold it. Furosemide, potassium of what? 3.1, too low, hypokalemia. I cannot give you furosemide. I need to hold it. I'm not giving it to you. Morphine, 2 milligram. The respiratory rate is 12. It's going to drop it more. We have a problem. Therefore, test taking strategy. The only thing that is left is number 4. Even though it's insulin and the other ones are more serious, you have to pick that. Therefore, number 4 is your right answer. This is the way you should approach it. Therefore, we're going to give the patient insulin. And that's the first thing because 1, 2, 3 are contraindicated in the patient. That's the rationale. Take a pen and paper, approach every question you see with that. This is also the same. It requires some critical thinking, But I got you. There's a buzzword you can use. How many times per day? That means frequency. Should the nurse expect to administer this medication? How many times? The nurse is reviewing a prescription for what? Carbamazepine. It does not matter. For a client with what? Seizure disorder. But then the meat of the question, I always read the question from the back. What is the meat? The nurse notes that the medication has a half-life of 3 days. That's your buzzword. Therefore, the two buzzwords you should focus on is what? 3 days and how many times per day should the nurse expect to administer the medication? What do you think? The 3 days changes everything. And half-life is what? How many days or hours it takes for the medication to be half of its dose. If I give you 20 milligrams of a medication and I say the half-life is 5 hours, that means 5 hours, you should have 10 milligrams in your system. And therefore, if this medication takes 3 days, that's the half-life. Before you can get half of the medication, how often should you give it to the patient? Once a day, twice a day, 3 times a day, 4 times a day. Because the half-life is very long, if you give them 4 times a day, it becomes toxic. If you give them 3 times a day, more toxic. 2 times a day is the problem. That means this medication is given once a day. How many times per day? Is once, because it takes a long time for your body to metabolize it. We're doing pharmacology, NCLEX practice question, using medication administration and safety. These are some of the things they talk about in the NCLEX in the test plan that came out about patients. Medication administration is one of the biggest areas students have problems. This is the way you should approach it. Question 4 down. Number 5, same strategy. Which action should the nurse take? What would you take? Know how to administer medication. This will help you in your clinicals or in your NCLEX prep. And then she's reviewing a client chart and see a prescription to obtain a trough. What is a trough? For the client IV antibiotic. You draw the blood sample immediately after the infusion is complete. Obtain the blood sample 30 minutes before the next scheduled dose. Draw the blood sample when the client reports peak drug effect. Collect the blood sample at halfway point between the two doses. The trough is the what? The lowest dose of that medication, and the peak is the highest dose. So when you draw a diagram of the medication, this is the peak and this is the trough. Medication go to the peak, the half-life is reached, then it comes down. That's why we give it to the patient. We don't want it to go to the lowest peak, lowest trough. Therefore, we give it a certain frequency. How would you know the trough? If I give you a medication right now and I draw your blood, I'm not getting the trough because then the medication is already in your system. Therefore, which one would you pick? Do you draw the sample immediately after the infusion? No, you've given the patient the medication. Obtain the sample 30 minutes before the next dose? Yes, because you've given to them, the medication has come down all the way. Now, on the next dose, you're going to give them the 30 minutes before you give it the next dose, the medication has been metabolized. So you probably will be having the lowest point of it. Draw the sample when the client report peak. The client has no clue about peak drug effect. Collect the blood sample at the halfway between the two doses. Halfway is the half-life. And therefore, the best answer choice is what? Number 2. So the peak and the trough are different. While the trough is drawn 30 minutes before the next dose, the peak is drawn after the dose. And therefore, the right answer is number 2. These are pharmacology, NCLEX practice questions with detailed answers and critical thinking using common sense and applying our knowledge regarding pharmacology, medication administration for nursing students and the NCLEX. Number 6, it's a little bit difficult. I want you to go for the buzzword. It says select and apply. With the following medication, should the client remain upright for at least 30 minutes and take a full glass of water? There's 2 parameters there. Don't run away from it and ignore it. 30 minutes upright and then full glass of water. That means you got to do both. And this is providing medication education to a client. You have 6 medication. Which one the content associated with it when you're teaching the patient how to take it, medication administration of this pharmacology, you got to take it with a full glass of water and you got to remain upright. Is it alendronate? Is it omeprazole? Is it risedronate? Is it levothyroxine, tetracycline, and potassium? If you don't know, you can see that there's a dronate here and dronate here. If you pick this, you got to pick that, right? Therefore, what do you think? Most of these medication, they causes esophagitis. They irritate your esophagus. That's why you got to remain upright. And some of them, you need a bunch of water to push them down. Which one? Alendronate or the bisphosphonate causes irritation. And therefore, you need what? Water, at the same time, remain upright. It's a must for both. Omeprazole, yeah, you take it with a full glass of water, but you don't need to remain upright. Risedronate is the same as alendronate, therefore, this is right. Levothyroxine is usually taken on an empty stomach. You don't need to remain upright, but you can take it with a full glass of water, empty stomach. Tetracycline causes esophagitis. You have to remain upright and a full glass of water. Potassium also causes irritation. Therefore, you need to remain upright with the full glass of water. Therefore, what do you think are the right answer? Alendronate is number one. You have to remain upright in a full glass of water. Risedronate, upright with the full glass of water. Tetracycline is upright with the full glass of water. And potassium, upright with the full glass of water. Remember, it has to cause esophagitis, and therefore you got to drink a lot of water with it, and you have to remain upright. A little bit tricky, but that's the answer choice. And then she's teaching the client about what? Transdermal patches. That means patch application to the skin, medication administration, which statement by the client indicate correct understanding. I will clean the site with an alcohol swab before I apply patch. Is this what you're going to teach the patient? I will rotate the application site weekly. Is that what you're going to tell the patient? I will apply the patch to an area of skin with no hair. Is this what you're going to teach? I will place the new patch on the side of the old patch. Whenever you have a patch, you got to teach the patient. First, no shaving of the site. That's number one. Second, we got to make sure it's thick. Number two, alcohol is going to irritate the skin, is going to improve absorption, and you have more problem with the patch. Therefore, don't do that. Use soap and water to clean the area. You need to rotate the site, not weekly. A week is too much. At minimum, most of the time is 72 hours. Therefore, this is too much. I will apply the patch to an area of the skin with no hair. That sounds right. But you don't shave it because you're going to cut yourself. And when you cut yourself, the medication gets absorbed. You have to master application of patch, especially with nitroglycerin. You got to teach the patient medication administration. I will place the new patch on the side of the old patch. No, you should rotate it so that it does not cause irritation. Therefore, what is the right answer? Rotate for 3 days, but daily is better. No alcohol, use soap and water, and therefore, which one indicate correct understanding? And that's number 3. Number 8, what is your score? I would like to know. Put it in the comment and let me know about it. Which question is bothering you? Which question is confusing? It's because it's content-related pharmacology. This one is also content-related. You may read about it and then you ignore the content associated with it. This is typical of insulin medication. So take a pen and paper and write this down. Which of the following medication orders should the nurse question? This prioritization, something is wrong before giving it to the patient. And nurse is reviewing insulin prescription for a client with what? Type 1 diabetes. A bunch of insulin types. You have to know the dosage, not actual the dosage. How frequent do you give it to them? That's what I mean, not the actual. The way we give it to the patient is very important. NPH insulin 40 unit sub-Q every morning at bedtime. What do you think? Insulin glycogen 25 units sub-Q once daily at bedtime. NPH 10 units sub-Q before meal 3 times a day. Insulin glycogen 15 units sub-Q twice a day. NPH insulin 12 units sub-Q once daily in the morning. There's the content. NPH is given, is what? NPH is an intermediate insulin. Glycogen is a long-acting. NPH can be given once or twice a day, but the dose matters. If you give him 40 units every morning and at bedtime, that's too much. We have to worry about it. And that's a problem. Glycogen 25 milligram daily, once daily, yes, it's okay. NPH insulin 10 units given before meal 3 times a day is not right. You don't need to eat it with meal. You don't need it to take it with meal. You don't need to. It's given BID. You can eat without it. Therefore, that's the key. Insulin glycogen 15 units twice daily is given once a day. That's a problem. NPH 12 units sub-Q once in the morning is okay. Get to be comfortable with insulin because it's very common. A lot of people use it. So you have to know which one is given once a day, twice a day, which one you need to have. You take it with meal. That's why we have fast-acting, long-acting, short-acting, intermediate. This is insulin pharmacology strategy. A client with chronic psoriasis is prescribed what? Topical steroid. Which instruction is most important for the nurse to include? The topical steroid instruction, similar to oral steroid. And you know what steroid does. These are medications that take a long time to work, and you don't need to stop it right away. You got to be careful. You don't take it for a long time. That is the content. Based on the little content I've given you, which one would you pick? Put down in your comment. Let me know about your comment. Describe what answer choice. Explain why you choose that. Or give me your score. 9 out of 9. Using sparingly on affected area, avoid prolonged use. Is that what you teach the patient? Apply to the affected area and cover the application with what? Occlusive dressing. Apply to unaffected area to prevent spreading. Discontinues the medication abruptly when the lesion improves. You know you cannot stop taking steroid. Therefore, you should taper it. 4 is wrong. How will you apply steroid to unaffected area? You're taking it because you want to apply it to the affected area. You should apply to affected area and cover it with occlusive dressing. When you put the dressing over it, it leads to systemic absorption. That's a problem. Use sparingly to an affected area. Avoid prolonged use. Yes, because it makes your skin very thin and it becomes ineffective. Therefore, number 1 is the right answer. Topical steroid, this is the content, this is the concept. Topical steroid for short use prevents skin thinning and systemic absorption, and that can give you side effects associated with Cushing. And the last question, what is your score? Let me know. Put down in the comment. This question is all the things associated with pharmacology that they can ask you everywhere. Which statement indicate further teaching is indicated? They don't know what they're talking about, or they're doing something wrong, or the teaching is inappropriate. And let's provide teaching to a client with hypokalemia, prescribe potassium chloride. How should we administer potassium? What do you teach the patient? I will take the medication with the full glass of water. We saw a question like that. I will break the medication for easy absorption. When you break it and chew it, I'll report muscle weakness. Says you have muscle weakness. I got to tell you about it. I should avoid taking the medication on empty stomach. We already seen potassium. Put down your answer. Let me know. We know it irritates your esophagus. You got to take it with the full glass of water, and you have to remain upright. Therefore, 4 is right. I'll report muscle weakness. Well, if you taking potassium, right, and you have hypokalemia, it means you have a problem. Therefore, I should know about it. Those are signs and symptoms that we got to worry about. Or if your potassium is high, I got to worry about it too. I will break the medication for easy absorption. It comes as a full medication. Don't break it, don't chew it. This is very important when it comes to potassium. Don't modify it. I will take the medication with the full glass of water because it causes irritation. Test taking strategies. If you don't even know, look at 1 and 4, they're saying the same thing. Therefore, you know both of them are right. Therefore, the nurse should teach the patient or intervene if the patient say they're going to manipulate the medication. Don't crash potassium, become more toxic. 10 questions. What is your score? English practice question. Pharmacology review for nursing students. These are the 10 questions you should master and how to approach them. Thank you for watching. If you like this video, put the like button, comment on the video, share it with your friend. If you need more, check Adapt NCLEX for more content like that. Take care of yourself and good luck in your exams.